Anyway, your sister did very well during the surgery.
Okay.
And she had quite a bit done on her. And so because we did so much for her, we actually put a catheter in her bladder.
Okay.
That, when she comes back tomorrow, we'll go ahead and remove it.
Okay.
She was normally for a surgery that's more than about 4 hours that we will, from start to finish, we want to go ahead and put a catheter in her.
Okay.
But in her case, it was around 5.5 hours. So she doesn't have that, but she doesn't have to worry about going to the bathroom
Okay.
and getting up there. But I do want her to get up and walk around at least once or twice today.
Okay.
If possible. So starting from the top all the way on down, she had quite a bit done. So we did a little bit of a modified type of brow lift for her. She had a very good part right here in the central. And normally we want to be lifting this up, but actually hers was more primarily here on the sides.
Right.
So she has two little cuts that we have inside her intertemporal area that's in the hairline, so she wants to be able to see. They're closed. You don't have to worry about those.
Okay.
Now the facelift itself and the neck lift are all kind of combined together. And it has just an incision that you'll see kind of starts off a little bit here, it goes all the way around the hairline,
Okay.
it goes back around and all the way back behind the ears.
Okay.
She actually has no drains in. We didn't have to put a drain in
Okay.
her because she doesn't bleed very much during this type of procedure.
Okay.
But like I said, the key thing to always remember after this is if you see and the things that usually can cause something like this is like when she's taking the pain medication, she doesn't take it with food, or she starts to have a cough or sneezing spell. That can cause the blood pressure to go up a little bit, and that can cause some of the bleeding. What you would see is that one of the sides might get a little bit more swollen. If you see something like that, do not hesitate to contact us.
Okay.
We do have an answering service that after hours will take care of it, or even our texting line will help us. If you have some questions, you can always send a text with a photograph of is there something we need to do about that.
Okay. Like a cold compress would be fine?
But you can put a cold compress on her. But she actually has a headdress that's on right now, so she has everything all wrapped up.
Okay.
And her hair's up in a ponytail up here.
Okay.
So she doesn't have to worry about taking it off. When she comes back tomorrow, I'm going to take everything off.
Okay.
Now she'll swell up like a turnip. She'll be very, very swollen.
I told her to prepare for that.
Quite a bit of this.
Okay.
And so we also did a couple other things too. We also did her eyelids.
Right.
So we did both her upper eyelids and lower eyelids. Once again, the key thing with this is that that's a very important area that we want to be concerned about of any type of bleeding. Now, she's going to leak a little bit of blood through the corners of there. That's very normal. See that you might see here, you might see here.
Okay.
That's not, but it's once again, if you see any stark or very pronounced swelling of one of the eyes. I've had this happen before where a patient, she was trying to take the pain medication, she didn't take it with food, and she started throwing up, and immediately one of the eyelids or eyes started swelling right up. That generally means we need to make sure that something's not going on because we don't want it to go, that blood to go behind the eye and cause problems with your vision.
Okay.
So the key thing, once again, is just to contact us if anything happens.
Okay.
And also, the other thing we also did is that we also did a laser treatment around her mouth right here. And so with that, there's a couple of things that always happen. One, it has to stay moist. We use Aquaphor. Is what you would like to use.
Already got that one.
Yeah, so just keep that lather on there. Don't ever let it get dry. The moment it starts to dry, it'll start to crack really bad.
So wash the face or don't wash the face?
You can go ahead and use
Gentle
like
cleanser?
normal soap and water and just kind of with a towel and just kind of pat it around here.
Okay.
Is all you need to do.
No rubbing?
No, don't rub it on there. And like I said, what you want to do is prevent this from ever getting dry around here. The moment it starts getting dry, it'll start to crack and bleed a lot more. Now, it's going to weep and heal for the next week or so,
Okay.
which is very normal. So
Okay.
the other thing I told her also was that if, for whatever reasons, lasers like to cause reactions with the herpes or the varicella zoster reaction. So she's not had any cold sores, but she has had chicken pox in the past, so she does have that virus in her. If something will happen, you might see little red bumps that start to form, and they're kind of very irritating. That is probably that zoster reinfection that we can treat her with, and that's all it's just contacts.
Okay.
Okay. Otherwise, like I said, the key thing afterwards is to keep her eyes, or keep her head elevated, keep her kind of at about a 30-degree angle.
I already got that set.
Okay. And one other thing, because I did both her upper eyelids and her lower eyelids, what I like to do, because the older you are, you sometimes don't have as strong as an eyelids on the lower ones. Hers was kind of on the teetering side. There was like going, do we want to do a little bit more, or do we want to give it a benefit of the doubt? So I gave her the benefit of the doubt, but what I do to insurance for that is I put in what's called a frost stitch. And so she's going to be squinty-eyed because she cannot, the eyes are actually kind of sewn shut just on the outside. There's a suture that I'll take out next week when I see her, but this is just temporarily there. She will be able to open her eyes and be able to see, but they won't be very wide. But once again, because of all the surgery that was done, she's going to see a lot of swelling and all this, and then it'll take a while. It's what we like to say is that you use cold compresses, cold peas, put it on the eyes, it'll make it feel much more comfortable.
Got that.
The eyes eyes are designed to be open a little bit, a slight slit to them. When I do this, because the muscles will actually be able to, over time, be able to close them completely. But natural tears or some type of lubricant that's in for the eyes, like lac glue, can be put on eyes at nighttime to make sure that they don't dry out at night.
Okay. Okay. I can grab that for her too. And her prescriptions.
Yes, her prescriptions have already been sent in. Once you drive on by the CVS, they should be already
Okay.
ready for her.
Okay.